Hello everyone, I am Dr. Shoini Munshi, practicing gynecologist in Kolkata, and today we will discuss what is known as preconception or pre-pregnancy counseling. So our main agenda would be to discuss what is a pre-pregnancy counseling, why is it important, what are the components of a pre-pregnancy counseling, and what is the general advice we give to people who wish to conceive. Now, what is a pre-pregnancy counseling? It is a session which is attended by couples who visit their gynecologist prior to conceiving, prior to planning a pregnancy. And why is it important? To understand its importance, one must realize that pregnancy is a miracle in which a life form grows inside a woman's body. And so the woman's body must be prepared. It should be in its optimal health to nurture the life that is growing inside her. A variety of physiological and hormonal changes occurs in the woman's body. The heart, the kidney, the lungs undergoes a variety of changes to nurture the baby inside her. And so it is absolutely necessary that a woman enters a pregnancy in optimal health so that she can get the favorable outcome of a beautiful journey called pregnancy. That is, a healthy mother and a healthy baby. So what are the components of a pre-pregnancy counseling? Generally, a gynecologist starts by taking a history. A history includes if a woman is suffering from chronic diseases like diabetes, hypertension, like pressure and asthma, epilepsy, or a variety of other disease which may affect the outcome of the health of the mother and the baby. The main purpose of taking such a history is to review the medicines, if she is on any medicines, to see that the medicines are safe for the baby which is growing inside her, and also let her optimize her health so that she enters the pregnancy in a healthy state. Then we ask for any family history of genetic diseases like thalassemia, like neural tube disorders affecting the brain, so that we may know if the woman or her partner has a history of genetic diseases in the family, and we may appropriately counsel her regarding the possibility of the disease being transmitted to the baby. Apart from that, what we do is we discuss the diet, the exercise schedule, the natural lifestyle which should be followed before embarking on the beautiful journey of pregnancy. Regarding diet, it is always advisable to embark on pregnancy at optimum weight. And how is that weight calculated? It is mostly calculated by an index which we call BMI. It is randomly available in the internet, and once you know your height and your weight, you just click on the BMI calculator and try to find out your own BMI. If the BMI is less than 25, that is a favorable weight. But if your BMI is more than 25, try losing some weight, because entering the pregnancy in a state of obesity may lead to certain complications like the baby, the growth restriction for the baby. For the mother, it may be diabetes, it may be hypertension, she may suffer some clotting disorders, she may suffer from preeclampsia and other complications which are not wanted. Other than this, also one must be careful to take in a lot of folate-rich ingredients in the food. And what are those ingredients? Those are mainly green leafy vegetables like cabbage, spinach, broccoli. And also, it is important she takes folic acid supplementation before pregnancy. That is when she is planning for pregnancy. And why is that so? It must be remembered that a woman realizes she is pregnant only after 4 weeks of her last bleeding. That is, she has already let 2 weeks into the pregnancy and the baby has grown inside her 2 weeks. In these 2 weeks, it is crucial that the baby's brain and the spinal cord develops naturally. And to development, for the natural development, a lot of folic acid is needed, which is mostly supplied by food, but it would be beneficial if it is taken preconceptionally rather than taking it after realizing you are pregnant. It prevents a lot of neural tube defects, the folic acid, and it is absolutely important in women who are diabetic, who have history of epilepsy, or history of neural tube defects in their family. From the lifestyle part, it is important that quitting smoking and drinking as well in pregnancy. Although, according to the UK guidelines, a woman who is trying to become pregnant, she may take 1 to 2 units per week without affecting her fertility status. But once she is pregnant, it is advised she stop drinking so that the baby's organs are not affected and a normal healthy baby develops inside the womb. Regarding exercise, any kind of exercise is recommended pre-pregnancy, but once you realize you are pregnant, you should avoid lifting heavy weights, but you can continue with moderate exercises like walking, like yoga, like swimming, etc. Then comes the important point, that is immunization. Immunization is a vaccination which can be given to women who are not pregnant so that once they become pregnant, they do not contract diseases which are preventable. The diseases like measles, mumps, rubella, chickenpox, etc., which can affect the fetus and the mother. So how can these diseases be prevented? These diseases can be prevented by administering vaccine prior to pregnancy, and it must be remembered, since these vaccines are live, they cannot be administered during pregnancy. Thus lies the importance of a pre-pregnancy counseling. Apart from this, what we do in a pre-pregnancy session is we advise for a battery of screening tests. Now, these screening tests are not absolutely essential for everyone, but if we suspect that you are having a high risk for certain disorders, we may advise you to do so. For example, if there is a family history of diabetes and if your BMI is more than 25, we would ask you to get yourself checked for diabetes, your HbA1c levels, your fasting, your postprandial blood sugar. Suppose you are suffering from asthma, we would like you to undergo a pulmonary function test so that once you enter the pregnancy and you may suffer an exacerbation of asthma that may be well tolerated. Also, we will review your asthma medicines so that your fetus is not affected. One more important point is, if you have already suffered 2 or more abortions in the past, that is, you are suffering from recurrent miscarriages, a pre-pregnancy counseling is very important for you. Why? Because we will do a battery of tests to diagnose the underlying problem which is leading to such losses, and we will treat you, and after the treatment has begun, you may continue with a healthy pregnancy and you can take home a healthy baby for sure. Apart from this, what we are also doing is we are advising a cervical smear to detect early cancerous changes if there are at all present in your cervix. What is cervix? Cervix is the mouth of the uterus, and this small test can detect early stages of cancer if at all they are present in the cervix, which can be treated, and after the treatment you can proceed to take a healthy pregnancy. So that is the most important, and to summarize, a preconceptional folic acid is must, diet, lifestyle modifications is must, keeping a BMI less than 25. All this will not only increase your chances of conception, but it will help you in embarking a beautiful journey of pregnancy in a healthy way. So thanks for watching my video, and if you have any queries, do leave them in the comment box. If you have taken the decision to carry on to increase your family and to have a healthy pregnancy, I just pray that you may achieve a healthy pregnancy soon. Keep faith, do not stress, and if you like my video, please do subscribe to my channel and share my video. Thank you.